So I'm going to let you read over these, but these are all conditions that would likely indicate a need for assistance. So maybe an induction or possibly a C-section. Your breathing and visualization techniques and relaxation that we've been talking about will still totally come in handy if your birth takes one of these courses. Just remember that one of the most important ways we can prepare mentally for birth is by allowing ourselves to have an open mind. I know many of you who are taking this course are planning for an unmedicated delivery, and I think having an open mind and allowing yourself to accept whatever turn your birthing takes will help you have success instead of being rigid on your thoughts about medical help if you need it. Okay, the onset of labor. Some women experience all the signs of the onset of labor, and some only experience one. The important thing is to just tune into any unusual signs. Your body will eventually send the message that your baby is ready to be born, I promise. Most natural or unmedicated birthing methods recommend that you labor at home for as long as possible. However, if your water breaks, your provider will probably recommend that you go to the hospital to be monitored because of the risk of infection. So just be sure to discuss this thoroughly with your provider to find out how long they feel comfortable with you laboring at home without that added pressure of medical interventions being introduced. So for the onset of labor, you'll have uterine contractions or surges, whatever word you like to use, that are rhythmic, tightening and which means they'll be tightening and releasing in a distinct pattern. They'll be timeable, less than 5 minutes apart. And then we've talked about release of membranes or when your water breaks. So for some, this is an early sign of labor. For others, this doesn't even happen until just before the baby is born. If this happens, be sure to check the fluid. You want to make sure that it's clear with no particles, except for maybe an occasional show of white vernix. Like I said, clear, so has no color and then has no putrid odor. Okay, now we're going to talk about slow or resting labor. The best way to meet a slow or resting labor is to just meet it with patience. A resting labor doesn't mean that immediate steps need to be taken to induce labor. You can actually ask your provider for some time to use natural methods to restart a resting labor before medical interventions are introduced. So if that's your goal, to stay away from medical interventions, try these things: the birth ball, a tub or jacuzzi, shower, humor, like we talked about, endorphins release are the feel-good hormone release and make it so catecholamine or stress, tension cannot be released. Light touch massage, going back to those feel-good hormones, walking, and then the last step, if your labor really has stalled, would be augmentation. And just talk this over with your provider and, like I said, be on the same page. Okay, the thinning and opening phase of labor is also referred to as the transitional phase. This is when those longitudinal fibers of the uterus will continue to draw back the circular fibers, going back to that video that we talked about, so that the cervix increasingly thins and totally dilates during this stage. This is kind of what you'll be feeling during this stage. So your stomach will feel as though it's surging or contracting upward, tightening, and then receding back down again like a wave. These contractions at this point usually last no more than 35 to 45 seconds. And at this point, you're going to want to use your breathing techniques to keep your body limp and relaxed to allow the stage to pass with little or no discomfort. So pull out your favorite breathing, your favorite visualization techniques for in between and during contractions. You'll want to make sure you're relaxed, keep drinking, and keep your bladder emptied. A full bladder can actually stall labor. Now we're going to talk about the hallmarks of labor nearing completion. The reason why we're talking about these hallmarks is so when you're in the thick of it and you feel like you want to give up, you'll notice these hallmarks and know that you are so close, that you're almost there, and that you can do it. So number one, your body heat will rise and drop alternatively. 1 second, you might be requesting a cool washcloth, and the next, you'll want a warm blanket. When you get up to empty your bladder, there might be a spot of blood on the white Chuck's pad. This is totally normal. Your body is directing everything down. You might start to hiccup, burp, feel nauseated, or even vomit as your diaphragm has an initial reaction to the lower contractions that are going to be the contractions that move your baby down to the birth canal. The good news is that it doesn't last long. You might feel a sudden need to escape. What I mean by this is when labor is nearing completion, even the most well-prepared mom might express the thought, I can't do this anymore. I've been in births with natural deliveries, and I've heard those exact words. I've heard, what am I doing? What am I doing? What was I thinking? This last hallmark is actually one of the most exciting because it means that the birth of your baby is probably right around the corner. And in that instance, it really was. That mom had 3 pushes and that baby was out. At this time, you're going to be getting into a birthing position, and you'll use your breathing during contractions to put power behind your breath and breathe that baby down. So now we finally get to talk about birth breathing, and we have the audio link down at the bottom if you want to listen to that at a separate time, but we'll listen to it right now.
Birth breathing. Allow your eyes to remain gently closed. Place the tip of your tongue at the back of your upper teeth and allow your lower jaw to recede and relax. When you feel the onset of a surge, follow it. Take in a short but deep breath through your nose and direct the energy of the breath to the lower back of your throat and down through your body behind your baby in the form of a J, down and forward. Allow the muscles in your vaginal area to open as though you were letting the breath out through them. Don't hang on to a breath beyond its effectiveness. Repeat this process by taking in another short, deep breath and breathe down in the same pattern as above, and then another. Repeat this motion several times with each surge or contraction as your body leads you. Firmly direct your breathing down through your body. Don't let the thrust of your breath escape through your mouth. Only practice this breath a few weeks before your expected birth time. The best place to practice is on the toilet as you are moving your bowels. Become aware of the pulsations that move the stool down and out. Your breaths are short intakes with gentle nudging breaths downward. Nothing forceful.
Okay, crowning. This is just getting more and more exciting. So at crowning, you actually get to finally see the results of your labor as the tip of the baby's head first becomes visible. You will feel encouraged when you reach this point. So let that encouragement take over. Let that power you through the end of your birth. When the top of the head is fully visible, 1 or 2 more contractions are typically all it takes to gently birth the baby's head. And tears can be avoided if you've practiced perineal massage. Practice. Don't take the perineal massage for granted. And there are no rushed, violent pushes. When I gave birth to my son, I had my mom in the room. She's the labor and delivery nurse, and I was at that part. The top of the head was fully visible, and she looked at me and said, okay, on this next contraction, it's going to happen. And that was just so encouraging to me. I knew I could do it. So on that next contraction, I went for this really intense push, and my doctor actually had to tell me to take slow breaths and not push at all and just breathe the baby down. And I think that's partly why he had to give me an episiotomy anyway, but I had an episiotomy and then I tore a little bit, and it was because of that violent push. So when you get to that point, work with your provider. If they tell you to push, push. If they tell you to just like slowly breathe that baby down, do your best to do that. I know it can be exciting to get that baby out, but that's the time where you're going to want your perineal massage. If you've done that, if you've practiced that, that'll come into play there, and you'll have success with hopefully no tearing. Okay, so post-birth activities, we made it to the end. You've got your reward. You have carried that baby for 9 months, and hopefully now you're able to do skin to skin right away and breastfeed that baby. It's recommended that you feed your baby within the first 30 minutes to 1 hour of life. Now this is because this is their most alert time. For the next 24 hours, they're going to be really sleepy. So sleepy, in fact, that since they haven't had to work for their food before, you may even have to wake them up to eat. You should be feeding them about every 2 to 3 hours, or if they're showing signs of hunger earlier than that, they may need to eat more often than every 2 to 3 hours. Your nurse will be good about checking your baby's weight to make sure their weight gain is good. And at your 2-week appointment with your pediatrician, they'll weigh your baby and assess the weight gain and decide the best plan of action for you. One of the really amazing things about newborns is that at 32 weeks, they develop the sucking reflex. Now, for those moms who have been to, ultrasounds, you've probably seen your baby sucking on their thumb or just sucking that amniotic fluid, and they're actually teaching themselves how to eat. It's also the main way that they're equipped to know how to soothe. So a lot of babies want to nurse for that closeness, that bonding with mom, and also for comfort and for food. So it's important to let them do that, but you also want to take care of yourself and make sure that you're comfortable. As you can imagine, with the constant sucking, you may experience some nipple pain, soreness, cracking, bleeding nipples. Those are things that we want to avoid. Some ways to avoid that is by using lanolin cream that can help moisturize the nipple and avoid the cracking, the dry, and the bleeding nipples. Another thing that's important to do is to let those breasts be open to air. Now let me give you an explanation for this that may make a little bit more sense. So when a baby has a diaper rash, the best thing to do for that diaper rash is to leave it open to air. So that's the same thing that we need to do if we've got sore nipples. We don't want to add anything on top of them that could increase the chafing or make it worse. After delivery, after your baby is born, shortly after, your placenta will be delivered. Because of the adrenaline that will be coursing through your body, and of course the happiness that you'll feel with meeting your baby, you probably won't even notice this happening, or if you do, it will feel good. It will be a relief to have that placenta out. At this time, your provider will also be doing any repairs that need to be done if there was any trauma during delivery. So if there was a tear or if you had to have an episiotomy that needed stitches, that will happen at this time. Now, those of you that are on the fence about unmedicated delivery are probably thinking, wait a minute, I don't want to go unmedicated and then have to get stitches. Don't worry. Most providers are able to use lidocaine. Lidocaine is a local anesthetic, meaning that it will only get to the tissues surrounding the area. It's like when you get a cavity filled at the dentist and they give you a shot, it numbs that area so they can work on it without there being pain. So it's the same thing. They can lidocaine the area before and then stitch it up. And if your provider is good and knows that's going to happen, they'll probably lidocaine you before baby comes out so that you're distracted by the pushing and the contractions and you probably won't even notice it. I had to have an episiotomy with my first. My provider warned me that this was going to happen, and so he let me know that he was going to be using some lidocaine, and it did sting a little bit, kind of like when you get a shot at the dentist, but the stitches weren't bad. I was mostly just focused on my beautiful new baby and excited that he was here, and of course the adrenaline. So we talked about your infant and the sucking reflex that they come equipped and born with. Now, a lot of people, if you're having nipple soreness or if it's just personal preference, may want to introduce a binky to their infant. This is something that's totally fine. The current recommendation from the American Pediatrics Association is to wait a full 24 hours before you actually introduce that binky.